Hello everyone, I am Mrudula and today's topic of discussion is the vital signs. So vital signs are the measurement of body's most basic functions. Vital signs reflects essential body functions including pulse rate, heart rate, then body temperature and the blood pressure. So vital signs change with the gender, age, then exercise capability, weight and the overall health. Now let's see the vital signs one by one. So first one is the temperature. So body temperature is a variable which is complex as well as the non-linear. The normal body temperature for an adult human is approximately 98.6 degrees Fahrenheit or 37.5 degrees. The human body temperature ranges between 36.5 to 37.5 degrees centigrade. The temperature is regulated in the hypothalamus in a narrow thermodynamic range. Healthcare providers use the axillary, rectal, oral and the tympanic membrane most commonly to record the body temperature, and the devices most commonly used to record the body temperatures are the electrical and infrared thermometers. They can monitor the temperature at different sites, and each site has its range as well as advantages and disadvantages. Now the second vital sign is the pulse rate. The most common site for measuring the peripheral pulses are radial pulse, ulnar pulse and the brachial pulse in the upper extremity. Then the posterior tibialis, dorsalis pedis as well as the femoral pulse in the lower extremity. Clinicians measure the carotid pulse in the neck. In day-to-day practice, the radial pulses is the most common used method for the measuring of peripheral pulses, where the pulses is palpated on the radial aspect of the forearm, just proximal to the wrist joint. Parameter for assessment of pulse rate includes its rate, rhythm, amplitude and the increase in pulses besides of the symmetry. The rate of pulses is significant to measure for assessing physiological and the pathological factors affecting the body. The normal range used in an adult is in between 60 to 100 beats per minute, with rate above 100 beats per minute and below 60 beats per minute is referred as the tachycardia and bradycardia respectively. The third important vital sign is the respiratory rate. The respiratory rate is the breath per minute. The normal breathing rate is about 12 to 20 breaths per minute in an average adult. In the pediatric group, it is defined by the particular group. Parameters important here again include rate, then depth of breathing and the pattern of breathing. Rates higher or lower than the expected range are termed as the tachycardia and the bradycardia. Tachycardia is described as the respiratory rate above 20 breaths per minute, and it is due to the physiological conditions such as exercise, emotional changes or pregnancy. Pathological conditions like pain, pneumonia, then asthma, foreign body aspiration, anxiety conditions, then carbon monoxide poisoning and the diabetic ketoacidosis, etc. Bradycardia is described as the condition where the ventilation is below 12 breaths per minute, and it is and can be seen due to the worsening of any underlying respiratory condition leading to the respiratory failure, or due to the usage of central nervous system depressants like alcohol, narcotics, then benzodiazepines. Now the fourth and the last vital sign is the blood pressure. So blood pressure is the essential vital sign which describes the hemodynamic condition in the patient. All healthcare providers should be aware of making sure all the essential prerequisites are made before checking the blood pressure. The patient should not have taken any caffeinated drink at least 1 hour before the checking, and should not have any smoked nicotine product at least 15 minutes before the checking. They should have emptied their bladder before checking the blood pressure. Full bladder adds 10 mmHg to the pressure readings. It is advisable to have the patient be seated before the 5 minutes of the checking their blood pressure. These steps take care or at least minimizes the higher readings that could have occurred secondary or to rushing in the clinical appointment. The provider should not be having any conversation with the patient while checking the blood pressure. Talking or active listening adds 10 mmHg to the pressure readings. The patient back and feet should be supported and their legs should be uncrossed. Unsupported back and feet adds 6 mmHg to the pressure readings, and crossed legs adds 2 to 4 mmHg to the pressure readings. The arm should be supported to the heart level. Unsupported arms add 10 mmHg to the pressure readings.